Hello, I'm Harvey Godwin Jr., Chairman of the Lumbee Tribe, and today I'm at the Lumbee Tribe Boys and Girls Club, where we've been having vaccinations for youth for a couple of weeks now. Kids have a spot to take their shot against COVID-19, ages 5 through 11. We're proud of the work that we're doing with the North Carolina Department of Health and Human Services and the other partners that they have collaborated with to make this opportunity possible for our people of all ages. And now I'm going to turn it over to our tribal administrator, Ms. Tammy Maynard, to introduce you to our guests from DHHS. Thank you.
I'd like to introduce two of our partners that are here with us today, Ms. Teresa Wiley with HHS and Mr. Will Stanley, also with HHS. They've been great partners to the Lumbee Tribe of North Carolina and working with us diligently to ensure that we provide vaccines to our community. Can you tell us a little bit more about yourselves, what you do, and your role in this process?
Thank you so much, Ms. Maynard, for this opportunity. My name is Teresa Wiley, and I bring greetings to you from the Carolina Community Tracing Collaborative on behalf of the Robeson County Local Health Department. And here's my partner, Will Stanley.
Hello, I'm Will Stanley. I work with the Office of Health Equity for the Department of Health and Human Services.
Thank you.
Tell us a little bit about why you decided to do these community outreach efforts the way they're being done in rural North Carolina.
Yeah, great. I'll actually allow Will to spend a little bit on that as the program director here for this site.
Yeah, so Department of Health and Human Services stood up 9 family vaccine sites across the state in response to the authorization of the Pfizer vaccine for ages 5 through 11. And the sites are meant to provide an access point for children and for families. And so you can receive a 5 through 11-year-old vaccine here, you can receive a 12 through 18-year-old, or adult Pfizer or Moderna vaccines, as well as boosters are available. And so it's intended to provide any service that people need.
Thank you, Will. I know, Tammy, you asked me earlier, so why would we want to promote our children to get vaccinated? So if you recall back in July, our children COVID-19 rates increased by 240%. And so that's a huge rate. And when we think about rural North Carolina and our children, it's very important that they get vaccinated so they can return to some normalcy and then also protect their siblings and their loved ones. In regards to the boosters are important for our most vulnerable populations because what it does, it actually heightens and increases the immune system currently in their body. If they got vaccinated, about a year ago, Tammy, that immune system or that immune count may have waned a little bit, which means it decreased a little bit. So getting that booster really increases it and it continues to keep them safe. And we're really promoting boosters for our healthcare workers, for those that are living in congregated settings, and then also for those that are that are just most vulnerable with some of those immunocompromised chronic conditions.
So for someone like me, who received their vaccine, the first vaccine, their first dose in February, and then I took the second dose in March, it would be time for me to take my booster.
It would be because what has happened, there has been a gap of 4 to 6 months. Yes. So that's that time frame that we're recommending for the boosters.
Okay, so that's very interesting. So if you've had your vaccine and you've had it more than 4 to 6 months, it's time for a booster.
That's correct.
Okay, I think that's a very important point.
And that's for ages 18 and older.
18 and older.
And for those that are considered at high risk, which are those categories that we just mentioned.
Can we share with people how this works for children, the ages 5 to 11? Do they get one vaccine? Do they get 2 doses? Is it 1 dose? I think families need to know what to expect with their kids that are 5 to 11. Can you share that with us?
Ms. Maynard, that is an excellent question. And so the children will receive 2 doses, but the key is that the dose is not the same as the adult dose. It is a smaller dose, but they do need to come back for their second dose. And so the key with the family sites is that the way that Will and his team has structured the family sites, it is set up to where if they get a first dose today, they'll be here to return to get their second dose.
That is wonderful. I think that's really important for our families to understand how this works with their children, because our children are so important to us. We love our kids, and we want what's absolutely best for them. So I think that is absolutely wonderful.
I do want to add one additional thing. So with the boosters, any brand of the boosters can be given. So you can match the boosters.
Oh, okay.
And the 3 brands that are available that are being provided today at this location by Old North State Medical Society on behalf of Dr. Karen Smith's office is J&J, the Moderna, and the Pfizer.
How long will this vaccination site be in operation?
So this site has been open since early November, and it's anticipated to go through the next few weeks at least.
Okay, so hopefully if our numbers increase, we can keep this as a site for our community so that people have easy access to being able to receive their booster, their vaccine, all in one location. And the good thing about this is not about just the Lumbee Tribe of North Carolina. This is about our community, and this is about everyone having access and making our community safer and healthier. Would you agree?
Agree. Thank you so much for this opportunity and providing this access point for all people here in Robeson County. We are dedicated to ensuring that our historically marginalized populations have access and get vaccinated. Do not wait to vaccinate.
This is the newest poster that you will see starting this weekend in your churches, in your schools, in your communities. We are encouraging our children to be vaccinated, ages 5 to 11. You will also receive this poster if you attend the Lumbee Tribe's Christmas event Friday night at the Lumbee Tribe Cultural Center, along with some great giveaways. So we hope to see you there.
Don't forget, December 10th, please come out to the Lumbee Tribe event and you'll get this nice tote bag along with some swag gifts. Don't wait to vaccinate.
I come in today to get the booster shot because this stuff's still out there, and I'm trying to prevent from getting it because I'm a diabetic, I have heart trouble, and I'm doing my best to keep from getting it.
Buenas tardes, mi nombre es Vilma Méndez Colombani y yo soy intérprete español. Estoy ayudando aquí al centro del club de Boys and Girls en Lumbee Trial. Estamos participando, estamos proveyendo vacunas para los niños de 5 a 11 años. Las 3 vacunas, la Pfizer, la Moderna y la Johnson. Los niños, las edades de los niños son de 5 a 11 años, eso es muy importante saberlo. El próximo viernes, diciembre 10, vamos a tener una actividad en el Centro Cultural en Maxton. Esta actividad va a ser para proveer estas vacunas. Para más información, por favor, busque en Facebook o comuníquese con el sitio de web de Lumbee Trial.